Welcome back to Real Talk Mind, Body, and Love. I'm Dr. Leslie Worth.
And I'm Dr. Kelly Frank.
And today our episode is Anatomy 101, Body Basics, Call It What It Is.
That's right.
All right, this is your forte, ma'am.
Yeah,
So
this is where I excel, what I basically have my doctorate in. So I am a pelvic health physical therapist. So I do talk about this every single day. And I was telling you just a little bit before, even yesterday, just, when I have a patient who's laying on the table, or even before we kind of get started, I always want to make sure, what do you know about yourself?
Sure.
Like if they walk in and just say, I have pain down there,
Right.
or, I have pain like when I pee, and then it's like, okay, we have to kind of dive a little deeper.
Right.
We have to kind of figure out what that is.
Right.
And I can
Or my
the same
lady
way.
parts hurt.
Right, my lady parts hurt, like my hoo-ha, like my chachi, like all these things, and you want to be able to clarify that when you're talking to a medical professional or anybody.
Well, from my understanding too, it's like we will call it a vagina, but
yeah, but that's not what everything is.
That's not what everything is.
Yeah.
So
yeah.
if I walk to my doctor and say my vagina hurts, they're probably going to think internally.
Exactly.
And it might not be internal. That's the problem. So we really need to have the correct terms, because that will make our talks with doctors more productive.
Yeah, exactly. Sure. So I guess we'll kind of go into it. So if I sound too, just kind of like
this is all
teacher.
I know.
Yeah.
This is it.
We kind of point
Hot
out.
topic, help me out.
I probably won't go in. There's too many teeth on that. I don't know why. We're not going to go into that. I don't know much about dentistry. But so we'll kind of dive into it. So I think the big thing is when we do talk about anatomy, we'll kind of start probably with the female pelvis.
Okay.
And here she is. So
I like this better.
You like that one? Yeah. She's nice too. Well, this is not the pelvis. This is just our vulva.
That's true.
Okay. But the pelvis, the cool thing is about everybody is that we all have pelvises, no matter who you are. It doesn't actually matter. This is kind of like the bony support structure that connects, the leg bone, the hip bone, the backbone. It's in the song. So,
But there's a difference between men
there's
and
a
women.
difference. There's a difference between the biological, male pelvis and the female pelvis. And it kind of has to do with with reproduction and just how the rest of our body kind of works. And so the male pelvis is going to be a little bit more narrow. They're not going to have that ability to, carry a baby, grow a fetus, evacuate a fetus. People always say that the sacrum, which is the big triangle bone here in the back, that the males is a little bit more rigid. Although I still find that a lot of men can have pain and dysfunction back here, similar to females. But really, aside from those two things, everything's a little bit more kind of set a little bit wider in a female. Again, just more because we're going to be carrying a little bit more weight here in the midline, possibly. So you kind of want to I think about that when I'm, prescribing squats or lunges, things like that. We're going to kind of have a different hip to leg structure than some men will. That's kind of not even a pelvic health tip. That's just an orthopedic tip, I guess. But yeah, that is kind of still just the pelvis. We all have the same, nerves and arteries. They might go to different organs. They might kind of go to different muscles. But the genealogy of it all, it's kind of the same.
Okay.
So let's see. So I think the main kind of differences, I'll bring her out.
Sheila?
Sheila. Yeah, we named her today. I've never named her. I don't know why I didn't name her. But kind of the main differences is kind of I guess, obvious. When you kind of start, there's something on the outside of the male pelvis that you kind of see. It kind of protrudes, and the female pelvis doesn't have that. But ideally, we still have the same, our reproductive organs are basically internal. Okay. Because that's also where the fetus will be. So that kind of makes sense that ours is going to probably stay a little bit more internal. The male, we still have...
indoor plumbing, outdoor plumbing.
But it's still plumbing, right? A house has to have plumbing. So it's really not, you're living in a shack or something. But then we all still have, we have a bowel. Everybody has bowels. Everybody has bladders. And we have reproductive organs.
And
so
all of us have pelvic floor muscles.
And we all have pelvic floor muscles.
Very good.
Yeah. So our pelvic floor muscles, and on everybody, they do look I mean, even if you kind of like see the inside, really the only difference between the male and the female pelvis is that there's just like one less hole.
Ah.
Kinda, yeah.
It's the best way to summarize it, I think, just between everybody is just one less hole, guys.
Yeah, just one less hole.
Yes.
But essentially, yeah, because if you just kind of like look on the inside, like it's still this like kind of basket weaved hammock situation of muscles running to kind of connect the pubic bone, which we all have, and the coccyx bone to the tailbone, which we all have.
Now, do women typically have more problems with pelvic floor muscles because of the design of the shape of the pelvic bone itself?
Yeah.
Okay.
Yeah, absolutely. So because of the shape of the pelvic bone being a little bit wider, being a little bit more round, having an extra hole, which is the vagina, that's the hole. We said it. Having that extra hole, there's really no more like bony landmarks to kind of keep everybody together.
So a lot is on that muscle tissue.
Yeah, a lot is on like this kind of like really just like couple bands of like thick muscle tissue. So that's why you're gonna see more in a female pelvis, like the idea of like prolapse, like pelvic organ prolapse, even urinary leakage. However, we see urinary leakage a lot in men when we talk about like after cancer diagnoses, prostate issues, things like that.
And where's the prostate on this dude?
He is up in here. It's like
Right
a little
there.
tiny
Walnut?
tiny walnut. Yeah. So, but it still connects, to the bladder. So it kind of like lives like right underneath the bladder, which again, like we just don't have that. So I also kind of think like when I meet patients who have maybe even had like a hysterectomy, which is like removal of the uterus, or a prostatectomy, which is removal of the prostate, I'm like, we've actually kind of even gotten like more similar. Like now we've just each lost like, something that we each didn't have. But absolutely, they can still have constipation issues. They can still have bladder issues. We can still have erectile dysfunction issues, whether it's, here in the vulva or here in the penis. Like these tissues are just so similar in nature. They're called something different.
But they're the same in fetal development until like that testosterone, estrogen.
Yeah, until like
in.
X and Y kind of figure out what they're doing.
That's why like the labia, which we'll get to, has it can get swollen and erectile a little bit because it's the same tissue as what would be in the
And even if
penis.
you kind of like look at like a male too, like you see like underneath the scrotum, it's like called like the scrotal, I'm gonna say it wrong, raphe, like RAPHE, and that would be like if you had a labia, like it would have developed there. So we were all kind of like geared to kind of like just be XX, and then XY happens, turns into a scrotum and penis.
Gotcha.
And
Dr. Kelly, can I ask you, because I think that there's a large portion, like if we were to hit the streets right now and just ask tons of men, do you have a pelvic floor? They'll probably like, no, right? And I think there's emphasis and attention drawn to the female pelvic floor. Like for instance, Kegels, right?
Yes.
People synonymize that with just being a female thing. Correct me if I'm wrong, but men can do something similar, or Kegels as well.
Yes, you can do a Kegel. Like
right? Like I think I'm doing them right now, I think. But like it's something that helps with, it's pelvic floor health in men. I mean, they don't think they acknowledge that. So just like sidebar real quick, talk to me about the male pelvic floor in a sense.
Yeah. So, I mean, men can still do Kegels. That's still like a very prescribed exercise if like weakness is the problem. And then the idea of like a reverse Kegel, which is kind of like that, like just letting,
like relaxing,
like your butt, like, anything down there, just kind of like letting that like fall and drop if things are kind of too tight.
I do that sometimes, and I thought I was weird, like for doing it. But like, there's a massive difference because you have such tension that you don't even walk around with.
Yeah,
Yes.
Yeah. A lot of people, I always kind of find that people are either like, some people can be both like a headache and a pelvic floor person, but like most people either like are migraine people and like their pelvic floor kind of is fine, or they kind of just like hold all this tension. Like maybe they've had a history of low back pain, hip pain, surgeries. Their pelvic floor is just like, just kind of like.
And I feel like
up.
it's a muscle group that we don't really are aware of or address. It's like I've gone to yoga and I feel like I've stretched everything, but I don't think my yoga teacher ever said relax your pelvic floor.
Yeah, yeah. Or they might be talking about something a little bit different, or because I treat a lot of like Pilates and yoga teachers, and sometimes we're like directly on the same page. Sometimes we're kind of like just like parallel to each other. But it's so interesting to kind of see, just what they know about the pelvic floor and like everything it does. and then how they treat that in whatever program or exercise or relaxation or massage or whatever. But yeah, so everybody could do a Kegel. It's just kind of like marketed more to women.
And I feel like that's because women have more potential issues with, like you said, prolapse and that kind of stuff. And men, you have that other bone structures and like a additional support beam there.
Well, and I think it bothers us more.
Sure.
Like, I think that's the thing, too, is, like, I've definitely met tons of men over my practice who, even if I was working with, like, a hip patient or something, and I'd, like, literally, like, hold on to their hips or whatever and just kind of be holding, and I'm like, it's like, squish, squish. And I'm like, are you wearing, like a Depend? You know what I mean? Like, I know what a Depend feels like.
No, this is my Calvin
basically,
Klein's.
they're just like, no, I'm not. And I'm like, like, sir, like, are you, like, we'll go to the side, like, are you having urinary leakage?
Right.
Like, you had a major hip surgery, like, you are older, like, you've had prostate that, like, I know you are, and it's okay.
Right. And I'll get you a whole episode of stigmas when it comes to men don't go to the doctors and women do, and just that whole, so that's a whole nother tangent we could go on.
Yeah. So it's like they just kind of don't do it. Whereas like, then maybe like even like equal part women are kind of like just, this is happening, but I'm just going to like not deal with it because I have 1,000 other things on my plate right now.
Sure.
Or, they're just like, I am leaking and this is not okay.
Right.
And like,
or
I need to deal with it.
They think it's normal.
Or they
I have
think
so many
normal.
girlfriends that are like, don't make me laugh so hard, I'm going to pee. And I'm like, it's
not normal.
That's not normal.
No.
Just because it's common doesn't mean it's healthy or normal.
Yeah, like all these muscles, like they should be able to, just like any other healthy muscle in the body, like just like your bicep, any of your feet muscles, your thigh muscles, they should be able to contract and they should be able to relax. They should kind of be able to live somewhere in the middle if we need to. But for sure, they shouldn't just kind of be in spasm unnecessarily or just so lax that like they're not even coming to the party to help out. So we want
sure, especially when we start to get into what it's holding up. And
I just want to keep doing voices for those, but I know it's inappropriate.
I know. I think she's the only one that has like multiple sets of eyes. Like she's kind of
adorable.
I know, and like these guys come apart.
And what is this?
Let's
name this.
I don't know. This is our little uterus. Yeah, I teach this when I teach little kids because it's just more fun to kind of like show like. Here's your little egg.
Now is the whole thing the uterus?
So our uterus is kind of more just like her eyeball situation up here.
Okay.
Down here is like that vaginal canal. So the vagina is okay. Let's start with that. Actually, let's go backwards. We're gonna go backwards.
Let me ask you quick. Do all cervixes and things? Do they have actual eyeballs on them? Do they come with eyes?
No.
Not that we know of.
Yeah. No, this would probably be like a diseased one. I would suspect endometriosis or something. Like, that's actually bad.
This is actually part of the X-Files.
We would have
So we
to
don't
excise
want-
that real fast.
No.
Our reproductive parts have actual eyeballs on them. Okay.
No.
They're not staring at you.
You learn something new every day?
Yeah, and you do. I mean, you never know. But yeah, let's just go back and start with that. So I think even for like female, like, biologic female anatomy, like everything on the outside is the vulva.
Right.
Everything on the inside is the vagina.
Right.
So that is like that vaginal canal. Vulva is everything on the outside. It's the outer labia. We call it the mons pubis. Like that's kind of like that bikini area. That all kind of grows. That's
where like
hair.
the pubic hair would grow.
So all the pubic hair grows. We have our labia minora, like our inner labia. That is just, again, full of like erectile tissue. That does change drastically during puberty, during postpartum, during perimenopause, during menopause.
And it can also be very healthy if the minora is larger than the major. Because I hear that too, where it's like what's beautiful, and it's what it's supposed to look like. And it comes in more than the 31 flavors, like
it's insane.
It can be anything.
It's insane. And it's, you just have to look at yours. And this is the part that people just kind of don't look and they don't kind of like unfold and they don't kind of like feel it and touch it. And just again, like any other part of your body, like if I sat here and like touched my arm and I'm like, ouch,
right,
that hurts. Like I don't think that's normal. I probably would go see like my
or
primary
if I
care
all
doctor.
Of a sudden got something like I look at my arm all the time, so I would know.
Yeah, like is it
changed.
hot red? Like it's hot red. Like that's not good. I'm probably burnt or something, or there's some problem. Or have an infection, but like looking at your labia from an early age just to identify it and just see what it is, see how it feels, how it reacts to touch.
Right.
Like it should not be uncomfortable. And then we kind of like even move a little bit further, which like no one knows where or what or how is like the clitoris, which we all kind of think of as like this little tiny little nub, but it really has like a whole hood. I should have worn like a hoodie or something today. It's cold enough outside, but you know, like we want to make sure that that is like mobile. Like, can you see it?
Right.
Like, is it just kind of stuck? If it's stuck and it kind of like hurts, like that's not okay.
Right, especially if it erects, like it will start pulling on that. And the clitoris is very, very sensitive.
Like, it's very sensitive and it's huge.
Yeah, what we see is literally the tip of the iceberg. Like this is not.
That's
it's
the
more
one.
internal.
I forgot that plushie. That plushie, I don't know where she is, but I have
bring
like
her
a
next time.
huge clitoris plushie. She's massive. But it is. It's like this, just like, I don't know, like almost like a Star Wars jet fighter situation thing. Like it just looks insane.
I almost think of I mean, forgive the comparison, like you know, if you're saying like the octopus, like where they're actually really all out. So you have like the main head, but then there's so much that is just like they're like flows.
Yeah.
It's beautiful.
Right,
Exactly.
and clitoral stimulation, if we're talking from a sexual side of things, can be stimulated internally.
Yes. Yeah.
By the vaginal canal.
Because it's just a huge organ that kind of extends. I think it's something like 4 inches,
3 or
maybe.
4 inches.
Yeah, it's
on
pretty
either
long.
side, it kind of like.
But then it's kind of the
drapes over it.
same. That's kind of the same tissue as like that erectile tissue, like of the penis. Like so, if you're again kind of like just looking at apples and oranges, like it is kind of the same thing. It's just aligned a little bit differently. So that's kind of cool. And then you still want to kind of like this little pink thing up here. This is like the urethra where we pee out of.
Yes, we do not pee out of our vagina.
Nope, no. Yeah, pee does not come out of here. Very separate hole.
Yes.
Yeah, very separate.
There's a lot
hole.
of women who don't realize that.
I have no idea.
Right.
Yeah, and that's another good point to like look at this like as you're going through puberty, as you're kind of growing up, or even like as you're aging. Because again, if you do try to use a tampon or a disc or a cup or whatever or whatever you want to put in there, you want to make sure it's going in the right hole.
Right.
Yeah, because the vaginal canal, that's the one that kind of
Or
like releases the blood,
also, if
not
you're having
the urethra.
Pain down there. Which
Which
going
hole?
back to it.
Yeah, just like which hole, like which thing. And I don't have like the anus on this one, but yeah, there's an anus too. So that's where the poop comes out. And it's all crazy because it's all so close together.
You're kidding.
Which I think brings our point of why it's so important to really know the terminology.
Know your
and the
terminology.
right labeling of everything.
Know your anatomy. What does it look like? Is it painful? Is it red? Is it burning? Is it hot? Is it discolored?
Which is a lot easier to do on the outside. Mirror or have your partner look at it, just to kind of see like, and the more you look at it, you're going to recognize that something's wrong.
Exactly. Yeah.
Perfect. So
yeah,
we covered the external. So I think
I only have a little
part
internal.
2 is the vagina.
There's a part 2 to this, everybody. There's a part 2.
Part 2. So I think we left you on a cliffhanger. So
Tune
stay
in next
tuned.
week for part 2, the vagina.
The vagina.
This is great. This is content.
I just saw the 5 minutes, so I was like, well, I thought it was a good pausing point before we